Has the COVID-19 pandemic affected us more than just physically? Today, we delve into the impact of this global health crisis on our mental well-being. In the background of this issue, we find that the COVID-19 pandemic has indeed triggered a surge in mental health problems. Illness, death, and the measures taken to mitigate the virus, such as social distancing, have all played a part in this. A noticeable increase in anxiety and depression rates was recorded in the United States from April to June 2020, compared to the same period the previous year. Our objective? To analyze mental health, substance use, and suicidal ideation in the United States during the COVID-19 pandemic. So how did we do this? A web-based survey was conducted among adults aged 18 years and older, with a sample size of 5,412 during the last week of June 2020. This included individuals who had participated in similar surveys in April and May. The survey measured symptoms of anxiety, depression, trauma-related disorders, TRDs, linked to COVID-19, substance use to cope with stress related to the pandemic, and suicidal ideation. Data was then analyzed based on several factors, including demographics and employment status. The results were alarming. Almost 41% of respondents reported at least one adverse mental or behavioral health condition. Nearly 31% reported symptoms of anxiety or depression. Over a quarter reported symptoms of COVID-19 related TRD. Over 13% had started or increased substance use to cope with the stress related to the pandemic, and over 10% had seriously considered suicide in the past 30 days. These conditions were more prevalent among certain demographics, including younger adults, racial or ethnic minorities, essential workers, and unpaid caregivers. The latter group, unpaid adult caregivers, had a significantly higher chance of developing new mental health conditions compared to others. However, these findings are not without limitations. The data was self-reported, and the web-based nature of the survey may not fully represent the entire U.S. population. So what can we conclude? The COVID-19 pandemic is associated with a significant increase in mental health problems, substance use, and suicidal ideation in the United States. Certain groups are at a higher risk, and public health efforts need to address these mental health issues and target interventions towards these high-risk groups. Strategies should include strengthening economic support, addressing racial discrimination stress, promoting social connection, and supporting people at risk for suicide. Further research is needed to identify factors contributing to mental health problems during the pandemic, such as social isolation and unemployment. In summary, the pandemic's impact on mental health is significant and requires targeted interventions. The mental health of our population is a public health priority now more than ever.